the campaign, Trump promised to allow Kennedy to have free rein on health matters. It's a confusing choice. He has been actively promoting misinformation against vaccines for many years, and his organization, Children's Health Defense, is a prominent anti-vaccine group in the U.S. and other countries. His efforts backing a Samoan anti-vaccine organization contributed to a rise in vaccine skepticism in the country, resulting in a 2019 measles outbreak that claimed the lives of 83 individuals, predominantly children. He has shared various other conspiracy theories about health, including claims that fluoride, which he believes is industrial waste, is connected to many diseases. He recommended that it be eliminated from all water systems in the U.S. He has suggested that herbicide exposure may be a possible cause of gender dysphoria and hinted at a connection between antidepressants and mass shootings. Kennedy shares similar beliefs with many scientists by linking America's chronic diseases to the prevalent availability of processed, unhealthy food, which he, along with nutrition policy experts, attribute partly to flawed agricultural policies. He has criticized corruption and conflicts of interest within the FDA's drug approval process that benefit major pharmaceutical companies over individuals, a sentiment shared by economists, scientists, and consumer advocates. Regardless of one's position on the political spectrum, most people can likely find some common ground with Kennedy. He embodies the increasing skepticism towards science and the public health establishment that numerous Americans experienced in the aftermath of the pandemic. HHS secretaries are typically experienced bureaucrats who have successfully navigated policy through government agencies, such as a state insurance commissioner appointed by Barack Obama or a pharmaceutical executive with tenure in Donald Trump's initial term. They generally comprehend the process of scientific research and the significance of a health intervention being supported by evidence. Kennedy lacks that resume, not even close. He will now have authority over a large portion of U.S. healthcare, prompting the question, what level of harm can he cause in this position? The response will be influenced by several factors. Initially, the Senate must approve him, unless the White House tries to bypass the chamber's constitutional advise and consent authority, and Republicans hold just a slim majority. Despite Kennedy's confirmation, Trump has additional crucial appointments to make in the healthcare sector, including for CMS, NIH, FDA, and CDC, who will also have significant influence over the administration's healthcare agenda. They might follow Kennedy's style or, like Trump's foreign policy choices, a combination of traditional and unconventional. As of now, Kennedy's nomination marks a pivotal time that may signal significant shifts in the American healthcare system. If Kennedy is confirmed, Republicans in Congress will have authority over the HHS budget, giving him significant leeway to implement his Make America Healthy Again plan with Trump's approval. If the Trump administration tries to dismiss government employees, such as those working in health agencies, valuable public health expertise may be lost at the CDC, FDA, and other places. It remains unclear if the judiciary, which is controlled by Republicans, would intervene to prevent any of it. This is what we understand about the intentions of the Trump Health Department, and the obstacles that may be in store. What RFK Jr. can and can't do on vaccines. In the past 3 decades, vaccines have prevented the deaths of over 1.1 million kids in the United States. During that time frame, they have also reduced direct healthcare expenses for Americans by $540 billion and saved trillions in social costs. Regular immunizations guard American children against 16 illnesses. During his campaign, Trump proposed cutting off funding for schools that required vaccines, but the federal government's power to enforce this is restricted. Even though Kennedy has a lengthy record of speaking out against vaccines, he stated in early November that he had no intention of confiscating anyone's vaccines. In an interview with NBC News, Kennedy emphasized the importance of individuals making informed decisions based on the best information available. I will ensure that scientific safety studies and effectiveness are available for people to make their own judgments on whether a product will benefit them. Yet, a co-chair of Trump's transition team recently stated that Kennedy desired to obtain federal health data in order to demonstrate vaccines are dangerous and remove them from the U.S. market. It's not as simple as it seems. Reversing the authorization of a vaccine that has already been approved would necessitate providing proof of harm that aligns with the FDA's criteria, but such evidence is non-existent. While it is possible for a loyalist appointed by Trump to change the FDA standards, it would probably face resistance from the drug companies that make the vaccines. The federal government would face a surge of costly and drawn-out legal battles. Pharmaceutical companies also have power in Congress, which is responsible for creating legislation that determines the fees of the pharmaceutical industry that fund almost half of the FDA's budget. The law must be reaffirmed before Trump's term ends, possibly leading to a fierce battle if there is disagreement over vaccines. Kennedy could address his vaccine side effects concern by reviving the National Vaccine Program Office, which was closed during Trump's first presidency despite its rigorous monitoring of vaccine safety. While it may be challenging to remove vaccines from the American market, Kennedy has stated that he has no intention of doing so. However, there are alternate methods he could employ to decrease the rate of vaccine usage. Kennedy might attempt to sway the CDC. The agency plays a crucial role in promoting vaccines in the U.S. by convening an advisory committee on immunization practices for expert recommendations and administering the Vaccines for Children program for free vaccines to low-income families' children. The advisory committee is not required by federal law. It is only assembled at the CDC's discretion. Under Kennedy, a CDC leader who doubted vaccines might choose to fill the committee with anti-vaxxers or disband it altogether. This would signify that the organization would no longer offer commonly accepted recommendations for vaccination that are currently relied upon by state health departments and numerous clinicians across the country. The program that provides vaccines for children is supported by a designated amount of money allocated by Congress to the CDC annually. Kennedy had the power to exert pressure on both Congress and the White House in order to eliminate the program by cutting its funding completely. This would result in low-income families needing to cover the cost of vaccinating their children. Kennedy will have the final responsibility for overseeing two major public insurance programs: Medicare, which provides coverage for the elderly, and Medicaid, which is managed by the states and provides coverage for those with low incomes. The federal government's disbursement of funds in both programs relies partly on the effectiveness of states and private insurers in vaccinating children and older adults in the programs. Kennedy may influence the CMS administrator to remove the vaccination mandate, which is why Trump's selection for CMS is worth keeping an eye on. The timeline for completing these tasks is uncertain. There is no previous instance of a president and HHS secretary, both openly adversarial to the U.S. public health infrastructure, taking charge of it. Despite potential delay, many are worried that providing a platform to a vaccine science denier could worsen public trust in vaccines, as well as other health recommendations that make up American public health. At present, isolated outbreaks of measles and other diseases are resurfacing due to declining vaccination rates, despite having been eradicated by vaccines in the past. Dr. Paul Offit, a pediatric infectious disease specialist who leads the Vaccine Education Center at the Children's Hospital of Pennsylvania in Philadelphia, stated that Kennedy's extensive influence makes it improbable for him to increase vaccine fear beyond what he has already done. Distributing vaccines through initiatives such as Vaccines for Children could be where the most harm is done. Causing disruption in that area could pose a serious issue. Can RFK Jr. really remove fluoride from U.S. water? Fluoridating of drinking water in the U.S. started in 1945. Children could be where the most harm is done. Causing disruption in that area could pose a serious issue. Can RFK Jr. really remove fluoride from U.S. water? Fluoridating of drinking water in the U.S. started in 1945. Approximately 209 million Americans currently consume tap water with added fluoride. The intervention is seen as a major victory for public health, as it significantly decreases tooth decay in children and also lowers tooth loss in adults. Kennedy, on the other hand, has indicated that he would promptly recommend the elimination of fluoride from community water sources. For what reason? Due to the fact that he is overstating the real danger. The majority of fluoride in U.S. tap water is artificially added by water utility companies, while certain tap water may also naturally absorb fluoride from the local water table. Approximately 2 million Americans consume tap water with elevated levels of fluoride that exceed the U.S. government's recommended amount by about double. A recent report from the U.S. National Toxicology Program suggests that consuming water with high levels of fluoride could be associated with a small decrease in IQ scores among children, ranging from 2 to 5 points. However, IQ scores are not a definitive measure of intelligence. Yet there is no evidence to suggest that tap water with regular fluoride levels carries this danger, and its advantages for the dental health of both children and adults are significant. The choice to add fluoride to water is made on a state and local level, so Kennedy could only suggest removing it. Yet his guidance at HHS may pave the way for anti-fluoride initiatives at the state level, as GOP officials are growing more opposed to established public health measures. Kennedy's campaign focuses on improving America's health by addressing the link between food and chronic diseases. Kennedy has urged for a movement targeting long-term illnesses that he labels as "Make America Healthy Again." The platform is broad and unclear, but the main focus is reversing the excessive control that Kennedy believes Big Pharma and Big Agriculture have over Americans' food choices and healthcare decisions. Some of the ideas have the same pseudoscientific basis as Kennedy's beliefs about vaccines. Kennedy recently took to social media to express his belief that the FDA was actively harming public health by aggressively limiting access to raw milk and other items. States have the option to not pasteurize milk, but the FDA mandates that milk sold interstate must be pasteurized. In spite of the dangers of serious diarrheal diseases and now bird flu associated with raw milk, states have the ability to create exemptions that permit their inhabitants to consume it. Some of Kennedy's beliefs about food are based more on real-world factors. For instance, his perspective on the impact of nutrition on chronic illness is accurate. He has observed that the U.S. has a poor track record in preventing diabetes, heart disease, and obesity, attributing it to lax government policies and dietary recommendations that encourage consumption of highly processed foods and limited physical activity in schools. In his battle against ultra-processed foods, Kennedy has expressed his desire to eliminate certain departments at the FDA, including the Center for Food Safety and Applied Nutrition. Recent reports in Science suggest that he has the power to influence the selection of the agency's leader in order to shut down that specific center, making Trump's selection for FDA commissioner crucial in shaping his administration's approach to public health. Nevertheless, Kennedy requires additional resources, not less, if he wants to limit the usage of food additives that have already been approved. The procedure includes thorough evaluations of information, releasing alerts to the public, and actively supervising the food inventory. If Kennedy managed to shut down the Food Safety Office, it would result in fewer people available for the job, making it more difficult, not easier, to regulate the use of these products. Additional measures that could be implemented by the Trump administration to decrease the presence of ultra-processed food in the American food supply may require actions outside of HHS. The USDA, under the guidance of the U.S. Department of Agriculture, controls school lunch programs impacting children's diets, with Trump yet to appoint a USDA commissioner. The USDA is mainly in charge of supervising factory farming, an industry that Kennedy has strongly spoken out against in his public life and promised to focus on if he were to work in the federal government. He would probably have to collaborate with the USDA to carry out the task. David Acheson, an expert in infectious diseases who has overseen food safety initiatives at both the USDA and the FDA, agrees with Kennedy that food safety regulation in the U.S. is chaotic. The USDA inspects meat, poultry, and egg plants daily, while FDA inspectors only visit other food production facilities like farms and industrial food manufacturers once a year. Unifying these functions under one agency and standardizing the frequency of food production facility inspections would be more logical to prevent any from being overlooked. This is the type of restructuring within the organization that could truly have an impact. Acheson also wants Kennedy to address the FDA's regulation of supplements, which currently lack proper oversight despite clear health risks. What will occur with the National Institutes of Health in a potential second term of Trump's presidency? During a town hall earlier this year before withdrawing from the presidential race, Kennedy proposed that if he won, he would instruct the NIH to halt drug development and infectious diseases research for 8 years and concentrate on chronic diseases instead. During his presidential campaign, he promised to also prevent gain-of-function research, where scientists enhance viruses to understand them better, which has faced increased scrutiny post-pandemic. In addition to the $20 billion already spent by the NIH on chronic disease each year, the potential consequences would be catastrophic. The foundational research funded and conducted by the agency in its own institutes is essential for the development of treatments by pharmaceutical companies for various health conditions. Kennedy has proposed dismissing 600 out of the agency's close to 19,000 workers and hiring new ones who are likely to be more willing to implement his agendas. Conservatives have suggested reorganizing the NIH, and Trump suggested reducing its $48 billion budget in his first term as well.